give you a profitable drug, whereas a tertiary healthcare drug is going to give you a huge profit. You come out with a drug, one of the most successful drugs is Viagra, for example. It's a tertiary healthcare problem. It's not a primary healthcare problem. We have no problem in Pakistan with Viagra. That's why we produce so many children every year. So we have no problems at all. It's developed countries which are aging, and where those who are aging want to relive their youth, and therefore they go in for something which was a blockbuster drug. Now, how is Viagra going to impact malaria in the world? And tablets are expensive. I don't know how much it costs, but it is certainly of the Cipro variety, that is, say, $5 a tablet, as opposed to half a cent a tablet, which is what you would pay for aspirin or something like that. And so you are not going to do research on aspirin or malaria. You will do research on cancer, on heart problems, and the tertiary problems. But your question was, knowing that the problem of the world is primary and not tertiary, and knowing that research and development is tertiary and not primary, how can you create a marriage between the two? That is the problem. And that's why your question is absolutely superb and central to the problem of global health. And the answer is that the state cannot do it, because the state in developed countries has to defend free market capitalism. And therefore they cannot force pharmaceutical companies, no, you must go and do some research on malaria. The state is not the answer. The answer is civil society. And that is you and me and all our students. And civil society, incidentally, is coming into play, because one of the resource bases of civil society are these extraordinary foundations from people who have made a lot of money out of capitalism, but who have money to spare. And this is the Bill Gates and the Warren Buffetts and the Ted Turners of this world, who have enormous amounts of money at their disposal. The Bill Gates Foundation now, which incorporates the Warren Buffett gift, has about $50 billion in its pocket. And they are devoting enormous amounts, not enormous, but significant amounts, to malaria eradication. And so you find that the foundations are doing it, civil society is doing it, and that is the glimmer of hope that we have about the end of a tunnel. And so your job as health students and health professionals is to put the focus, the spotlight on this problem, that you do want to defend free market capitalism, but that you also want to defend life, the right to life in developing countries. And somehow we have to put greater attention to it. You can do the research yourself as to how much money is being put into, let's say, malaria eradication in Africa, as opposed to peace and stability in Iraq. Do the comparison yourself, do the figures yourself, and arrive at your own conclusion as to which has the greater potential of leading to a happier world in the larger context. Which of the two, and how much money is being devoted to the one as opposed to the other, and therefore which is likely to be more successful. That is a statistic that you have to work out yourself. Your second question is about AIDS and feminization. This problem has nothing to do with AIDS. It has to do with men. And the solution to this problem is to get rid of all the men in the world. You do that, and you will find that AIDS will no longer be as feminized as it is, and certainly not in Africa. In some countries, there is a sort of accepted social behavior of men going to bed with multiple women. And if one of them becomes the vector in that line, any one woman or the man, then the vector is going to spread through the whole process. And if the vector is a trucker, it's going to spread that much faster and that much more devastatingly. Now, what is the solution to this? We know the solution. A country which has done great work on this is Uganda. The president of Uganda, who is a very intelligent person and who faced the problem, was able to pull down the statistics on AIDS through what he called ABC. I think it was abstinence, I forget what, but the C was condoms. The B I do not remember. But the idea was that if you can improve social behavior, and if you can use techniques like condoms, then at least you hold the disease steady. Now, I hope that you, all the students, know that AIDS is not a reversible disease. AIDS is like diabetes. Once you have it, you have it. But you can stop its spread. Millions of people around the world are living with diabetes and they don't die because we've learned how to control diabetes through a series of measures, cutting down sugar, cutting down salt, more active lifestyle, etc. So it's a combination of lifestyle and sugar intake plus drugs in some cases. And with that, you have controlled diabetes. You are not going to get rid of it, but you will not allow it to spread. We can do the same thing in AIDS, but we are not putting the proper amount of focus on it in terms of lifestyle, which is important. And if you can't be going round in happy cohabitation with different women. I mean, just because Mr. Spitzer does it does not mean that the rest of us should do it. And so lifestyle plus methodology, which is condoms, etc., and ultimately the concept of abstinence, which is, wait until you are married and stick to just one person. So these are formulas which have been used in Uganda successfully. And I think we can do them elsewhere also. Now, your question was, what is UNAIDS doing? UNAIDS is not highly funded either. We know the amount of money we need. And at one stage, grandiloquently, it was announced that $10 billion would be put into it every year by the United States. And it hasn't been put in. And the result is that we just don't have enough funds to create greater awareness, greater education, greater mushrooming the market, flooding the market with condoms and devices like that. All these are doable things. Now, AIDS is coming into control in India. It is coming into control in Eastern Europe. It is not quite coming into control yet in China, and it is certainly not in control in Africa. And so we know the map of the problems of the world, but we need to put more funding behind it. Over to Lockhaven for...
Good morning. Thank you for a very interesting presentation and discussion. I'll begin by asking our first question. This student has a cold, so she's asked me to read it for her. This is Katie Nickerson's question. She asks, what do you believe would make the global fund to fight AIDS, TB, and malaria more effective? And we have a second question from another student.
Hi, my name is Josh Ketchum. There's a shortage of doctors and nurses in Africa who leave to find better work, and this brain drain has devastated the healthcare system to the point where for every 100,000 people, sometimes there's as few as 10 nurses, far short of the World Health Organization's recommended 100. I'm curious, how can the UN or the World Health Organization persuade doctors to remain in the area, or persuade doctors from other nations to commit their help to counter the shortages?
Okay, on the first one, I'm sorry, I have a focus on problems of funding and poverty, and so you must excuse me for the fact that I see everything through money-colored glasses. And the problem is that we just do not have enough money in the Global Fund. Now, remember, money is not dollars.